A diastolic rumbling murmur is typical for mitral stenosis. Notice the increased S1 and loud opening snap that accompany this murmur. I will start with 3 normal beats and then add the murmur. In mitral stenosis, the A2 to opening snap interval is related to the severity of the obstruction. Patients with severe mitral stenosis often have an A2 to opening snap interval of 80 milliseconds or less. Listen to a patient with mitral stenosis. I will start with 3 normal beats, and then add the opening snap, and finally the diastolic murmur. The murmur of mitral stenosis is low-pitched and requires the bell of the stethoscope to be held lightly on the chest wall. Newer electronic stethoscopes make this murmur easier to hear. The murmur of mitral stenosis becomes louder with maneuvers that increase heart rate. An easy way to produce this effect at the bedside is to have the patient perform a few sit-ups. Note the change in this murmur as the heart rate increases. With the advent of 3-dimensional echocardiography, new details on mitral valve pathology are becoming available. This image shows mitral stenosis from the view of the left atrium. Mitral stenosis and mitral regurgitation can sometimes occur together, and it can be challenging to detect the presence of mitral stenosis in this setting. Listen to the combined murmurs of mitral stenosis and regurgitation. I will start with 3 normal beats, and then add the opening snap, then the murmur of mitral stenosis, and finally the murmur of mitral regurgitation. According to the American College of Cardiology guidelines, transthoracic Doppler echocardiography remains the best diagnostic test to quantify mitral valve disease. Listen once again to a patient with combined mitral stenosis and regurgitation. Percutaneous mitral balloon commissurotomy is an effective treatment for symptomatic patients with mitral stenosis who have appropriate anatomic findings. These findings include commissural fusion of non-calcified pliable leaflets with no left atrial thrombus nor significant mitral regurgitation. Transesophageal echocardiography should be performed prior to balloon commissurotomy to exclude the presence of left atrial thrombus. Listen once again to a patient with pure mitral stenosis. In summary, mitral stenosis, although decreasing in developed countries, remains a continuing challenge in much of the world. Diagnostic and therapeutic advances for this disease have led to successful intervention by cardiologists. Listen once again to combined mitral stenosis and regurgitation.